Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Once again, Jim Stallings on vacation this week. Filling in is Dave Wilson. Good morning, everybody, and welcome to Health Talk, sponsored by Mon General Hospital. I'm Kay Murray, along with Dave Wilson. Good morning, Dave.
Good morning, Kay.
I know these are subjects you love.
Oh, yeah.
The medical end. Since you couldn't become a doctor, you became a radio
I know,
guy.
yeah.
So
Big disappointment to my mother.
No, I'm sure it's not. Well, we're going to talk to the doctor this morning, and he is Dr. Faisal Bukeirat, and we're going to talk about the new endoscopy center at Mon General Hospital. Good morning.
Morning to you.
And how proud are you of this new center?
I'm excited. The way I look at it, if you have not been to Mon General lately, probably you should visit. Everything is being upgraded and polished. Cardiac center, ortho center, and finally an endo center that will cater to our patients and our community.
And talk about the center, what it offers, and with this upgrade, what does it mean for the hospital and for the community?
Well, basically, it is a specialized area where we do our endoscopic procedures. Currently, we are doing them in the OR. We have dedicated rooms in the main operating room. But we are moving out to a specialized and dedicated area on the second floor of the hospital where everything is brand new, equipment is up to date. We have a dedicated fluoroscopy room, which is room number 4, where we have the most advanced technology in that room built in already. We have many new toys coming aboard that will help us take care of our patients who in our community and who come to us from other facilities.
When I hear new toys, I don't think it's $10 or $12. It sounds like quite an investment by Mon General.
It is quite an investment.
When you say new equipment, new technology, can you explain that to us? And as a patient that may have to use some of this new equipment, what will it do that it hasn't done before?
Well, first of all, just coming and having a regular procedure will be much smoother, much more efficient. The wait time should be much less than it used to be. You come to the endoscopy center where you'll be taken to the back. The procedure will be done. There is no wait because you are not waiting to the other OR cases to move along. Mm-hmm. So for me, if I'm a patient, you give me an appointment at 8. I would like you to get me on my time because there are other things that to be done in my life, and everybody is busy. So getting in and out on time is a major achievement. We have upgraded radiology equipment where we have a stationary table now to do our therapeutic endoscopy. Sometimes we need X-ray to look and see what we are doing. Whether it's deployment of a stent to relieve an obstructed colon. Instead of surgery, we put a stent temporarily, either till they get to their definitive surgery or till the patient will get their chemoradiation. For that, we need to see under X-ray vision. And we have a brand new table that is really state-of-the-art, and I'm proud of Mon General for taking that step forward.
You know, you understand when people say, I never want to see that table, but there will be times that we may have to.
Many times. Monday, for example, we kept working till around 1 a.m. in the morning, having started at 7 the previous morning.
Mm-hmm. So when I think of an endoscope, I think of colonoscopies. I think of blocked airways. But you're saying also this is something that can be used for the heart?
Well, the heart center is totally separate. My job, I'm a digestive disease specialist. In general, medical care in general is shifting toward non-invasive technology, meaning if you can do things without opening the patient up, that's the route to go, because the recovery time is much shorter and the morbidity is much less. So basically, in my specialty, we focus on doing upper endoscopy. We have endoscopic ultrasound to stage various GI cancers, particularly pancreatic cancers, cancers of the gallbladder, bile duct, people with obstructive jaundice if they have an obstructed biliary system, people who are sick from an obstructing stone, whether they're in gallbladder or in the bile duct, people with pancreatitis due to an obstructive lesion. All of those patients will benefit from endoscopic intervention. So any therapeutic intervention that you do perform to relieve an obstruction, to relieve a tumor, to remove a tumor, to remove a polyp. But colonoscopy is only one part of the endoscopy center. It's not all that we do.
And you mentioned the new technology making things a little more efficient and less invasive. That's got to help encourage people who might be a little timid or a little standoffish about going and getting checked out for some of these diseases. Maybe be a little encouragement or a little music to their ears that there are now procedures and ways to do this that'll be less invasive and, again, recover much more quickly.
I agree with you totally. Number one, people should look at the track record, should look at our training, should ask our other patients who had been to Mount General about their experience, and just take a feedback from that.
And equipment is wonderful, and and thank goodness Mount General's there and upgrading all the time. What about the staffing in the center? Can you talk about that as well?
I absolutely can. Although I'm not part of administration, I don't make the rules or the schedule for staffing. But one thing I can tell you for sure: they go out of their way to make sure that we are well staffed and our patients are cared for. When we say we treat you like family, I really take it to heart. And if I don't see that happening, trust me, I will complain about it, and action will be taken, or corrective action will be taken. So yes, the staff will be dedicated staff completely in the endo center. There will be dedicated anesthesia people down there. It's going to be just a beautiful thing to have and see.
This is a specialized end, though. That's why I'm asking about the staff, and that the training and those that are in there, we can feel very confident that the right people are being in the center to take care of us.
Absolutely. The way I look at it, when I see my patients in general, I usually tell them I would recommend to you what I would recommend for my own family. So when we'll discuss all the options. We'll put the options on the table, 1, 2, 3, 4 through 10 or whatever. Mm-hmm. And then I would recommend, you take this option. That's what I would recommend for my own family. Absolutely.
Most of us have had a colonoscopy or have had to go through having some type of a treatment like this. And it's not painful. And that is because usually you're put into a twilight sleep or you're put under during that time?
All of those procedures are done by either what we call conscious sedation, which is the twilight, or either a deeper sedation, which is done by anesthesia. Almost exclusively, when we move to the new endo center, patients will be put to sleep by anesthesia. You don't have to be intubated, meaning you're not on the machine to breathe for you. Mm-hmm. But you are not going to know what hit you. You are going to go in, have the procedure come out, and not remember anything about it. So it's totally painless. All my colleagues, I will put my life and health in their hands. All of them are extremely competent. We have an excellent surgical department for backup in case a patient will require open surgery. So I do believe, short of liver transplantation, which we don't have anywhere in West Virginia, short of liver transplantation, I do believe at Mount General we do have the complete package.
And the after effects of having an endoscope, talk about that. Do we have any side effects of having the procedure done?
The side effects really reflect patient general health. If you are not in good health before the procedure, you might have difficulty waking up from anesthesia. If you had a large polyp or a large tumor removed, you might bleed a little. If you had an ERCP done and a cut, there are risks for any procedure. A human body, you put tubes in, you put instruments in, you can have a perforation, you can have bleeding, you can have infection, you can have, people could die from, complication due to medications or instrumentation or procedures. But these are well-known complications that we list on the consent form, but rarely ever happen, thanks God. Our track record personally, my track record speaks volumes of that. And as I said before, we really take pride in dealing with our patients and their families.
And I'm sure the scope is used for prevention. Is that correct? Prevention medicine as well?
But the prevention comes down to two things. People who have long history of acid reflux, where we screen them for Barrett's mucosa, which is a change in the lining due to chronic acid reflux, and screening for colorectal cancer, which is by colonoscopy. But we use much more for therapeutic intervention, for treatment, for dealing with various digestive problems. So prevention is only part of the problem. But people are more familiar with colonoscopy because, once you get to a certain age or if you have a certain family history, you are encouraged to have a colonoscopy. Let's take colonoscopy because it's a common thing.
Yes. 304-296-0041. If you have a question or a comment this morning, we're talking about the new endoscopy center at Mon General Hospital. Some new toys that we want to talk about, new equipment being brought in. We'll talk more about that after this break.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Dr. Faisal Bukeirat, our guest this morning, Health Talk, sponsored by Mon General Hospital. If you have a question or comment, 304-296-0041. We're talking about new equipment, and I can just tell by the way you're talking this morning that you're very proud and feel that this is really a move forward for the new endoscopy or the updated endoscopy center. Let's talk about some of the toys that you mentioned. First of all, the spyglass. What is that? Can you explain it to us?
For a long time, we have been able to go through the biliary tract and look at the X-ray picture of it. Now, we had technology before that we called mother-daughter scope. We can use a miniature scope to go through the larger scope and go into the bile duct and actually enter it. Now, we have a miniature scope that goes through the scope that we call a spyglass to allow us to go inside the bile duct and inside the pancreas and take direct biopsies or take a look if indicated. And it just exciting that we have this technology right here in West Virginia.
You just used that term, and I was thinking while you're talking how much it is an asset for West Virginia to have this kind of technology, and you wonder where else can they go with this type of technology. They've come a long way.
Absolutely. We have come a long way, and we keep adding, and we keep up to date, and we keep up to par with the best hospitals there are. I mean, Mon General is not listed as a top 10 in the U.S. because other hospitals like Johns Hopkins or Mass General have much more resources, much more money, and much more staff. But we strive very hard to do the best job we can do in our fields.
Ultrasound, is that another piece of technology?
We have endoscopic ultrasound with the most up-to-date technology. The machine has electronic head, and we can just about reach anywhere within the inside of the human. We can reach liver, pancreas, adrenals, lymph nodes in the mediastinum, anywhere we can need to get biopsy or inject or do any therapeutic intervention. And yes, we do have a brand new tower and 3 specialized endoscopes, 1 radial and 2 linear echo endoscopes that we have at Mon General.
And you brought up a good point about having this technology in West Virginia. I don't know if you got the answer, but how rare is it to have this kind of brand new technology in what is a rural state, and versus having them we expect them at Johns Hopkins and the big hospitals, but a rural state like this, is it rare to have these kinds of technologies, and is it a privilege?
It is definitely a privilege, and we do provide these services for our community and for our surrounding communities. So I'm really humbled and touched that we have patients who come from 2, 3, 4, 5 hours away to come to be with us at Mon General and see what can we do to best help them in their situation.
Okay, it's great to know that you don't have to go to Baltimore or Cleveland or Columbus. You can go right down the road. You can stay at home to get get this kind of care.
Which is why we do these shows, just to let you know what assistance, what medical assistance, what we have right here in Morgantown. And we've learned through today that must be very proud to have this update of the Endoscopy Center at Mon General Hospital. If you have any questions or comment, phone lines are open. We'll be back and tell you more after this break.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Talking with Dr. Faisal Bukeirat this morning, and we've been talking about all the new toys, the new center opening up. When does it officially get opened up?
I think the official date is Monday, August the 6th.
The 1st of August, it will be open.
Yeah, we are not far away from it.
Any grand opening plans, or just there it is? And I know Greg Kealey's in the studio with us. Greg, do you plan anything big for this?
We are going to do a little bit of a celebration. Number one for employees, Health Grades, a national independent ratings organization, has rated Mon General as the top hospital in the state for patient satisfaction, basically, or the patient experience. And we're going to align that with the opening of our endoscopy opening on August 1st. So we are going to have a big thank you to our employees on August 1st and also give tours of the endoscopy area.
And what a great asset it is to our community. And we were talking in the break about how important it is to know your doctor and know the procedure and not just walk into a clinic. And you hear a lot of advertising about cleansings and colon cleansing, and you need to know exactly what you're doing before you walk into just a clinic to do things like this.
Definitely a valid point. There are these are not medical clinics. These are clinics, healthy clinics, they call them, where they can detoxify your body and give you a cathartic. And some of these things are really not safe. So I would advise see your GI specialist or see your local physician or primary care physician before you spend your money on dangerous technology that's out there.
When you say dangerous, what are we doing to our body if we in fact go into a clinic and do something like this out of town?
One example that comes to mind, if somebody has a problem with their kidneys, they have renal insufficiency and renal failure, and they take certain cleansing solutions, can basically kill them.
Well, that's good to know and to understand. Again, it's so important. And you need to be referred by your doctor to get into the clinic? Or into the center?
No, it depends upon the situation. Unfortunately, most of us are ruled by their insurance, so you go by what your insurance tells you. Most of the time you don't need to, but usually your physician will refer you to a GI specialist or a provider who can provide these services. If you don't have a primary care physician, you can just call any physician of your liking. You can call my office at 598-2700 and we'll be more than happy to help you.
Good. And I'm sure this is usually a same-day procedure?
All the procedures in the endoscopy center are same-day procedures. We do have some inpatients who require interventions, but the majority are outpatient procedures. They come in and they go home the same day.
That's good to hear. And Greg, you mentioned this grand opening, the 1st of August. The public, any part that we can play in this?
At this point, we're probably not going to do a public open house per se, but we are going to thank employees and all the great medical staff like Dr. Bukeirat and his fine group of professionals, and also the board and all the people who have contributed to this really exciting development for the patients of Mon General and also the outlying area, that they have some more options now. So.
Thank you, Greg, and thank you, Dr. Bukeirat, for being on the show today. We appreciate it and learning about the updated endoscopy center.